Hey friends, Dennis Ernst here with the Center for Phlebotomy Education. You know, the second most common reason laboratories reject blood samples is because tubes with anticoagulants arrive clotted. It's only because they're not properly mixed. So let's talk about proper mixing. But first, it's important for everyone who draws blood to understand that red blood cells are to be considered fragile crystal orbs. They don't tolerate a lot of turbulence. And when they're subjected to excessive mixing, well, then the cells are just going to rupture, and that's when samples get rejected because they're hemolyzed. But for today, let's talk about rejection because they're clotted and how to properly mix to prevent that kind of rejection. So first of all, why is it so difficult to properly mix a tube? Well, I think it's because we got so many people out there with so many different styles. You know, we got the kind that just think jiggling is enough, and they just kind of jiggle a little bit, and then we got the jugglers who like to juggle, and well, they say, oh, I guess that's mixed pretty good. And then you got the little mixers that like to, you know, play bartender, and they're mixing their Tom Collins. Well, I tell you, it's not that difficult, but we have to be methodical in teaching it. So how do you teach proper mixing? First, we go out and get the biggest tube we can find. Something like this. I'd just like to walk into a patient's room with one of these some morning. Oh, good morning, Mr. Smith. Need to draw your blood today. Only need one tube. Wait till you see the needle. Okay, whatever it takes, find a prop, get something. What you want to demonstrate here is that when a tube of blood is filled, we've got this headspace of an air bubble, okay? And because tubes have additives coated to the sides, it's this air bubble that does the mixing. So see, when the tube gets inverted and we give time for that air bubble to rise, that air bubble generates friction on the walls of the tube and erodes off that additive and gets it well mixed into the sample. But if we don't take time to let that air bubble rise, we're not going to have the benefit of that friction. So all the way down, we let the air bubble rise, all the way back up, and let the air bubble rise again. That's one inversion. Now, most manufacturers will say you allow your tubes to invert 5 to 8 times. So all the way down, pause, all the way up, pause, one inversion, 5 to 8 times. And then that will probably make your sample rejection rate due to clotted samples go way down. So that's all we have to remember. Let the air bubble do the mixing, and also shaking is breaking.